begin then. Right? And we're on. Yes, it is. Okay. Hey,
Hi, Rose.
how are you? And so I think we might be live on Facebook.
Great.
Okay. And I've got everything queued up.
Excellent.
And I don't know, can you hear the music? You probably can.
Yes.
Yeah, we're just doing that. And you look great.
Thank
So
you.
just let me know. So I just want to alert you for our in-house audience. Our projector resolution wasn't great. So the anatomical 4 slides, I made a colored handout. So just so you know, for our in-house audience, they're going to refer to an actual hard copy of those 4 slides where you're showing where we annotated. But the virtual audience is fine. They'll get to see everything on the slide.
Okay, great.
Just so you know. Okay?
That's great. Thank you.
Okay. So I think what we're going to do is I am going to, we're just going to hang out here. If you want to, you can mute yourself for right now.
Okay.
And we're going to start the introduction probably around 3 of 9. And then at 9, you're going to start. Good morning and thank you. couple of housekeeping things, especially to the virtual audience. You have a link pasted in the chat for the PDF format of the booklet. So please download it. This way you'll know exactly what the workshop is about, who the clinicians are. You can take a look at the program of what's coming up later in the morning. And then after lunch break, so we're going to break after the second session in the morning for about an hour. And then at 1 o'clock, we're going to be promptly back on, and you will have to log into the afternoon YouTube link. Please, that was provided for you for the afternoon sessions, and I hope you can join us. We've got an amazing sort of Eastern philosophy and mental health wellness for you in the afternoon. And at the end of the morning, I will also paste into the chat a very brief, like a 5-question survey, if you don't mind, for the virtual audience. Please fill it out. It takes literally less than a minute. Yeah. We would greatly appreciate your feedback. And without further ado, I'm going to introduce Dr. Diana Lee, and she will introduce our first guest. Thank you.
And good morning. Thank you so much. I'm Dr. Diana Lee, and I want to thank Dr. Rosemary for originally approaching me to work with her. And
So we forgot to unmute you, but I unmuted it when you started talking. You couldn't hear me? No, we heard you. We didn't hear Dr. Hunley the first time because you kept yourself muted. So when I came back to the comments, so I had to unmute you.
Okay, so
But they can hear you now.
they can't hear anything that's coming through.
Yeah.
For those that are here, if you don't have a program that's like a copy, they're right there in the front of the room. And I am going to introduce Dr. Chandler
You can
Thompson,
remove
who
us.
Dr. Grace met
We
at
don't
a
need
conference,
this up there.
a PAMA conference. And it has been really such a treasure to know her. We have met with her, spoken with her. She is so talented and experienced. Dr. Thompson was a professor of voice, and she really is an expert. She's a pathologist of voice. She sees many patients with different disorders, of voice. So
Sorry, I didn't mean to mute
with further ado, she's just fantastic, and I just feel very, very fortunate to be able to present her, and we'll enjoy a wonderful presentation with her. So please welcome Dr. Thompson.
So we're going to remove myself, right?
Good morning, everyone. I hope you can hear me. I'm coming to you live from Massachusetts this morning, and I'm thrilled to be speaking with you about the voice. I'm hoping to be able to see my slides in just a moment, but I wanted to thank Dr. Diana Lee and Rose Grace for having me. I met them through the Performing Arts Medicine Association, which is something that you might be interested in looking into. It brings together educators and health practitioners, such as physicians, therapists, anyone who treats or teaches those in the performing arts, multidisciplinary group, dance, all the instruments and voice and acting. And I've learned so much through the research that they've done. And this is how I met Dr. Lee and Dr. Grace. So thank you so much for having me. I want to explain the letters behind my name because I get questions about this a lot. So we'll just stay on this first slide for a quick moment. The DMA is a Doctor of Musical Arts, and mine is in vocal performance. And I got that degree at Michigan State University. And like many of you who are music students, I did lots of recitals, lots of choir work, lots of touring, performing in all different venues, and really learning my craft as well as learning more about my instrument and my body. The MS is a Master of Science degree, and that is in speech language pathology. So I decided midway through my teaching career that I also wanted to be able to help people who had injured their voice in some way. And in the United States, the best way to do that is to get a degree in speech and then specialize within the speech language pathology arena just in voice disorders, which is what I do. The CCCSLP is your Certificate of Clinical Competence in Speech, And that's something that my licensing group awards you after you've worked a certain amount of time. I'm currently working as an assistant professor of otolaryngology, and that's a fancy word for ENT, ear, nose, and throat, at the Mayo Clinic in Jacksonville, Florida. So that's who I am. And today I really feel that we have a kind of wide audience, and I want to help you learn a little bit about your voice, but to explore how you can take care of your own voice and be in touch with your own instrument. So I've mentioned the first two already. PAMA, the second dot there, offers a certification in performing arts medicine through the American College of Sports Medicine. And it's fairly rigorous training and a little test that you take so that you can screen other performers. I'm not a dancer, but I certainly work with singers who dance. And if they're reporting a problem, that I know some screenings I could put them through before sending them on for the right professional help. I'm also a member of NATS, National Association of Teachers of Singing, and I'm currently the president of the Northeast Florida chapter of NATS. So I really try to keep a foot in both camps, both the performing, teaching side of singing and the medical side of singing. We'll talk a little more about that as we go. So next slide. We think in terms of three, some say four, but I'm going to make it easier and put three subsystems of vocal production. So starting at the lowest level, the power or respiratory system. That's really how you power your voice. So we'll be talking some about respiration and how you can assess yourself for that. The source of the sound is actually the vibration of the vocal folds. So that's coming up to this level. So everything below this level is part of that power or respiratory system. The source of the sound is the vibration of the vocal folds, which are set in motion by the air coming from underneath. And then everything above this we call the filter or the resonance system. So when I'm either teaching a singing lesson or working with someone who's had a vocal setback, I'm sort of looking at these three subsystems separately. But of course, the real goal is that the three work in concert together. So if you are experiencing a voice issue, it might be nice for you to think in these three subsystem terms to see if you can determine if your sinuses are blocked and you're having trouble accessing a good resonance. That's subsystem 3. So we'll talk more about each one. This is kind of a schematic, and this is available on Google Images if you ever wanted to look at this. I know it's sort of small for those of us in the virtual audience, but the light pink colored labels are really showing you that power or respiratory subsystem, which includes the diaphragm, the abdominal muscles, the lungs, the chest wall, and then, of course, the trachea. And I've had a few patients who had a kind of minor chest wall injury that they didn't think much of, but it definitely impacted how they managed that respiratory system. You'll see that the vocal folds themselves are just the larynx and the muscles around it, and the vocal folds living inside the larynx are the blue shaded areas. And then everything above that shaded in yellow, the oral cavity, the lips, the tongue, the pharynx, the soft palate, and the nasal cavities are the resonance system. And of course, the brain runs all of this. So just wanted to give you a visual of the three subsystems and how they work. This is kind of a complicated diagram, but I have the red arrows and I've circled an area. The circled area is the hyoid bone, and it rests right here, and it's the only free floating bone in the body. And we consider that the top of the laryngeal complex, which is that hyoid bone, several cartilages, and some muscles. The middle arrow is called the thyroid cartilage, not to be confused with the thyroid gland, which I won't be speaking about today. And right inside where that middle arrow is where the vocal folds live. And in males, the prominence, kind of where the arrow is the Adam's apple. In males, the thyroid cartilage is more pointed, and in females, more rounded. And we're not going to have much time to talk about gender transitioning, but for those who are going from male to female, this is an area that might get shaved in order to make that prominence less obvious. So then the bottom cartilage, where the lower arrow is called the cricoid cartilage, and it's shaped somewhat like this ring, which is low in the front where the arrow is and high in the back. And in the back, there are some little cartilages we can't see called arytenoids that turn. They sit here and they turn, and they are on the back of the vocal folds. So it's a very exquisite process, and we'll be looking at a video of how it all works together in a moment. This I just like to show because under the tip of the chin and going back, there are some muscles that if these get very tight, certainly if you're a jaw clencher, this sling of muscles where the long red arrow is pointing, that is the hyoid bone that we just looked at. And so starting to put some of the muscles in, you can see that tension in any of these areas that we normally don't think of as the voice can impact how much that hyoid bone can raise and lower. When we swallow, the hyoid and indeed the whole laryngeal complex comes up and tilts forward to open the opening into the esophagus to allow the food or beverage to go down, or the saliva or the mucus. We swallow lots of stuff in a day. So I just wanted to show that sometimes one of the nicest things you can do, and we'll take a moment to do this now, is to get your thumbs, and we're just going to walk them under this area, those two little muscles. And you can see if you leave your thumbs there and swallow, you'll feel a little pressure against your thumbs. And it shows you how strong those muscles are and how if that gets really tight, that can impact the hyoid bone. All right, this is a bird's eye view, meaning if I crawl to the back of your tongue and look down, this might be what I would see. So on the outermost area is the thyroid cartilage. And coming in, you can see toward the back, those little, looks like little triangles. Those are the arytenoid cartilages. And at the little prominence at the front of there is where the vocal folds attach. So this is a view of someone breathing or in kind of a neutral position, because I can see between the vocal folds, which are those two little cord-looking structures that run from the points on the arytenoid down to an attachment on the bottom of the, in this picture, of the thyroid cartilage. When we make sound, they come together. So this is breathing, this is making sound, and we call the area between the vocal folds the glottis. So if I say someone has an open glottis, it's open, and if it's closed, that means they're making sound of some kind. All right, everyone is a voice user. We tend to think of singers, actors as, oh, I'm a professional voice user. But honestly, teachers use their voices more than just about anyone. So if you are a singer who also teaches, you are asking a lot of your voice. If you're in sales of any kind, maybe you sell cars, or maybe you are online doing some type of support, teaching online. Maybe you're doing IT support. If you're good at that, that requires voice use. Certainly any member of the clergy, doesn't matter what religion or denomination or faith group they follow, If they need to project their voice to lead a group of people, that's a professional voice user. Any broadcaster, they learn certain types of delivery like this. Today in Jacksonville is partly cloudy, and that takes several years to learn that delivery. So basically, anyone whose job requires the use of their voice is a professional voice user. And I like to tell my singers and actors and teachers to really think of yourselves as vocal athletes. And you have an allowance. If I'm given $50 to eat while I'm on a tour, and I spend $48 of that allowance in the first 2 days, I don't have much left to work with. The same is true of your voice. So if you know you have a singing lesson, a choir rehearsal, and then an opera or musical theater rehearsal later that evening, that add up how much voice use you have. You can't really afford to go out and be loud with your friends if you really need that voice allowance for the things you are slated to do with your voice for that day. So just wrap your head around the fact that you're a professional voice user and you need to budget the use of your voice. Okay, who's involved in care of the voice? Number one is you, the user of the voice. You know your body, you know your voice. Your singing and or acting teacher knows a lot about your voice because they work with you on a weekly basis. They know, gee, this person seems to be doing everything right, but I'm hearing a little something in the voice. So that might spark a discussion. And certainly now that I'm on the medical side of voice care, we get most of our referrals from these first two groups. The singer or voice user themselves will come and say, nobody's really hearing me is very hoarse, but I know something is different about my voice. Or the singing teacher will say, I really want the student to get, looked at because something's not quite right with the voice. A vocal coach actually is something different than a singing teacher. The way that I describe it is the coach helps you learn a role or a specific style, makes suggestions based on your voice type and sometimes even your personality on what repertoire you should be thinking about and exploring for your voice. Many times the vocal coach does know a lot about the voice, but sometimes they don't. Sometimes they've had excellent training. Maybe they're an excellent pianist. Maybe they know a lot about the literature itself, but they might not know as much about the vocal apparatus. So certainly they can say, you were doing this song really well the last 3 times we rehearsed. Now something's a little different. Speak with your teacher about it or go and get it looked at. A dialect coach, if you are cast in a role that requires you to have a different dialect and you're working really hard on that, you might be making an accommodation in your larynx that's working against you mechanically. So you have to try to figure those out. And I'll show you an example in The Lion King in a moment. Certainly someone that does what I do, a speech language pathologist who is a voice specialist. And even though I trained in the full scope of practice for speech pathology, I don't work with people who've had a stroke. I don't necessarily, I have a little training, but it's not my group. I've specialized in just the voice. But many speech pathologists work with children with articulation issues, individuals on the autism spectrum, people who've had cochlear implants. It's a great profession, almost requires that you specialize in some way. A body worker, maybe you have the advantage of being near someone that teaches Alexander technique or Feldenkrais or any other number of, it used to be called Andover method, and now I think it's just body mapping. I've done bits and pieces of all of that. I've had more experience myself in the Alexander technique, but all of those modalities teach you how to master your own body and have ways to check in with your body. An ENT physician and a laryngologist are two different specialties in a way. An ENT, if I'm being correct, it would be otorhinolaryngologist, does ears, noses, and throats. And very often that's who you might have access to in your local community. And that's a great place to start because they can diagnose sinus issues. They might send you for allergy testing. They can prescribe short courses of medication to see if that takes care of it. But a laryngologist, number 8 on the list, is first an ENT who has then done a 1 or 2 year specialized fellowship after their ENT training just in the larynx. The larynx does breathing, swallowing, and phonation or talking / singing. And the brain prioritizes the larynx in that order. The brain will always prioritize breathing because if you're not breathing, you have no need to swallow or talk. It will then prioritize swallow second, and voice will be sacrificed in the moment if it has to be. So if you've been exercising strenuously, which is taxing your breathing system a lot, I mean, that's kind of the point of some aerobic activities, you may find that your voice doesn't sound good or it's hard to carry on a conversation. And that's why. So the laryngologist does just those 3 things. So if you come to my clinic at Mayo Clinic and you see Dr. Amy Rutt, who's the laryngologist I work with, and me, and you start talking with her about earaches, she's going to say, I'm really sorry, but I don't treat the ears. I can send you to one of my ENT colleagues. So there's a need for both, and it's always a good idea to start with your ENT physician, and most of them will know their own limits on what they can treat with the voice and what they feel they can't. So this is a great book that I got this from. It's referenced here, Adam Rubin. He's up in Detroit. He was an actor before he became a physician. He's a great laryngologist, and he wrote this book called The Vocal Pit Stop. It is wonderful. If you are a performer of any kind, you owe it to yourself to get this book because it will teach you a lot about how to take care of your voice. And it's written for voice users. It's not a scholarly, I mean, it has some good research behind it, but it's written for the user of the voice. And so I'm crediting him with this graphic. The voice team puts the patient in the center. And then there's the voice pathologist, which is what I do, the director of a show or the conductor of an orchestra or choir that you might be performing with, the singing teacher, and the laryngologist. Many times, these are the ones that make the decisions to, or give you the guidance. You own the voice and you get to make the final decision. When I worked in Boston, I had a really up and coming, who's now doing very well, rap artist. And his producer brought him. He said, you know, this is a taxing show. We're getting ready to go on tour. This person is still in their teens. We need some guidance on what can and can't happen in a healthy way over the course of a tour. And so all of us put together, helped guide that process, and he was able to do the tour. If you come to us for a laryngeal examination, it could be performed by an ENT or a laryngologist, or in every state except Pennsylvania, a speech pathologist. That's just the law in Pennsylvania, and I'm just throwing that out there. So we're going to use either in the image on the left of the screen, a rigid scope, which gives us great magnification. And we hold your tongue with a piece of gauze to help get the base of the tongue out of the way. And it's a rigid scope. It doesn't go in all that far. And it casts a light down and lets us look at the motion of your vocal folds to see if there's anything on them, like nodules or polyps, that shouldn't be there. But the awkward part about this scope is we can't have you speak, we can't have you sing, because we've got a piece of steel, a rigid piece of steel in there. So all we can have you say is E, but it does give great images. We'll be applying a stroboscopy light, which helps slow down the motion so we can really see what's happening. Are they moving apart at the same distance and at the same rate? Are they coming together? Are they vibrating synchronously? More often, we'll use the other scope, which we scope through your nose. And now that we've all been through COVID testing, our test doesn't seem so bad because it's not like a COVID test, because we have a camera. We can see where we're going. We put some numbing gel on the scope. We can spray the nose with something to open the nose, a decongestant, and a little bit of numbing. The numbing lasts about 15 minutes. And then we'll thread this little skinny fiber optic camera through your nose and get down above the vocal folds. We don't touch the vocal folds and we don't go below them. And we can have you speak, we can have you sing. I can often say, sing me 6 measures of something you're having trouble with. And the person will, and now we can film it. When we remove the scope, we play back the entire exam for you, and we go frame by frame and tell you, this looks good, this one's not moving as well. So this is really the gold standard of diagnostics for looking at the voice. So that's why you want a laryngologist. An ENT has the scope that looks through the nose, but has probably not invested in the stroboscopy lighting system, which shows the fine movement. And that's often for singers what makes the big difference. So I have a couple of videos. I'd actually like to start, if it's possible, with the second one, The Art of Breathing. Both of these videos are on YouTube, and you can look them up yourself. But The Art of Breathing is going to show us the big skeletal pieces like the rib cage, the shoulder blades, the clavicles, and then it's going to layer in the diaphragm. Most people think the diaphragm is in the front, kind of right above the belly button, but those are actually your abdominal muscles. The diaphragm is a bowl-shaped muscle that runs front to back, and you'll see that it lowers and raises, and it's this woman, Jessica Wolf, has done a really nice job with this animation. So if it's possible, let's start with Art of Breathing. So there's an exhale. This is a front view. Inhale. You can see even in the back, the shoulder blades, the scapulas need to move. That is the diaphragm, that large muscle. So when we inhale, it drops. And as we exhale, it rises. And the lungs sit right on top of the diaphragm. So there's the exhale. Inhale. Now muscles that help pull the rib cage up, and certain ones help pull it back in. Back to just the diaphragm. So if you teach this course in vocal anatomy, vocal pedagogy, you might want to look into Jessica Wolf's entire series. It's very informative and very well done. It's a nice balance between pure science and applied science, and it's pretty accessible for students at any level. I had the pleasure of working with her briefly in New York, and but that little 1-minute video is free on YouTube, and you can use it for yourself or in your teaching. Now we're going to look at a video also from YouTube. This is from Dr. James Thomas. He's a laryngologist in the Northwest, and we're just going to look at normal female vocal folds.
Here's a look at some normal young female vocal cords during a stroboscopic exam.
See how they're coming together? Low pitch, shorter and fatter, a little floppier. Mid-pitch, vibrating normally, no bumps or lesions. Little spots of mucus are there. The higher pitch, they're stretched longer from front to back. Pitch glide.
The other way around.
The structure at the very bottom of the screen that looks like kind of a shoehorn is the epiglottis. And the reason we have you say the vowel E is to get that guy up and out of the way. It tilts further forward on the E vowel so our camera can peer behind it. All right, so if you come to my office and you've seen Dr. Rutt and one of us, she or I, have scoped you, these are things I'm going to be asking you. What is your voice history? Have you had problems in the past? I'm going to want to know if you were a cheerleader in middle school or high school or currently, because that's a different use of the voice. A relevant medical history and any current medications, current comorbidities. So maybe you have asthma, maybe you're being treated for diabetes, maybe, so that would affect, you know, the asthma might give you differences in your respiratory control. Some of the medications for diabetes can play a role in how the voice acts. And certainly if you were going to need any kind of vocal fold surgery, if you have diabetes, then it might affect the rate of healing. Any vocal training that you've had or are currently having. And I want to put an aside here. I worked in New York 2 different times and in Boston before moving to Florida. And I found that many of the professional vocalists, especially in New York, stopped taking singing lessons when they got their first role, largely due to time and money constraints. But it's kind of the time they needed the most guidance. So keep that in mind if that's the pathway that you hope to pursue. I've been offering singing lessons to a few of my former patients, especially during the pandemic, just to keep their voices going. I meet with them 45 minutes once a month. They can record the lesson, they can keep replaying it. So I'm not making them come every week, but I'm giving them a way to check in. So that's something to keep in mind. What are your vocal demands? Personal, professional, and singing. Also in New York, pre-pandemic, mostly a lot of people who are performers also have jobs waiting tables or being bartenders or working in catering jobs where they pass trays of food or bartend at large gatherings. That's very vocally demanding. Many of them have a Sunday morning church job that pays, but they've just done, 3 shows on Saturday and they have 2 more Sunday afternoon and evening. That's a very vocally intense weekend. So those are things that you must budget for. The other thing I will do is what we call laryngeal function studies. I actually have ways to measure acoustic and aerodynamic use of your voice and run it through a program of normative values for age and gender and compare your numbers to other people in your age group. It doesn't really change what I do, but it gives information that the video stroboscopy, just the camera, can't tell me. How hard are you working? Are you using too much air pressure? Is too much air escaping? Those would be some of the aerodynamic things. Acoustically, is your pitch range normal? We have a certain number of semitones that is a normal number of semitones if you do a pitch glide. That's it. I can measure a lot from just that one measure right there. And then, of course, the laryngeal video stroboscopy. If you see me first, I might do the strobe, then Dr. Rutt would join us, or vice versa. If she sees you first and she's already done the strobe, I'll do the rest of this. So in the model that we follow, you would see the laryngologist and the speech pathologist in the same visit. One of the places I worked in New York, that was not the case. You only saw the doctor, and if the doctor thought you needed a speech evaluation, you would make another appointment and come back. But in COVID, we already had this model at Mayo, but in COVID, it's especially helpful because we require a COVID test less than 48 hours before you come to see us. And so you get 2 visits in on the same COVID test day. Your body is your voice. So routine daily voice use places demands on the body that may contribute to the development of voice or musculoskeletal injury. And I see this come into play a lot. I've had a number of rock musicians who tour, and I have to say to them, when you're going from tour stop A to tour stop B, if you're flying, be quiet on the plane. If you're taking a bus from different places, get on the bus and be quiet, because you're wearing out your voice before you're ever getting to the paid gig. The other place I see this is on choir tours. And it's fun to be with your friends, and it's fun to talk about the last concert or the next concert or place you ate or something funny that happened. But that can lead to being loud, where you're talking with much more collision force using your vocal folds, and that can wear you out before you even get to the performance. I got the next statistic from my PAMA colleagues that anywhere from 50 to 80% of musicians experience physical problems at some point in their careers. And of course, for us in the singing world, it's primarily the voice, but not only the voice. You could have a neck injury, which will certainly impact how you use your voice, or you could break a rib in a fall. My patients and students who've been in musical theater, who do sometimes 12 shows a week, if the role is physically demanding, a lot of jumping around, choreography, lifting a partner, pulling a heavy cart, I can think of one show that happened. It places a demand on your body that you didn't really think you'd have to address when you were just studying singing. So all of these things play a part in your total body use and how it can affect your voice. Certainly, what I'm going to talk about if we do therapy together, and we'll touch on a lot of this today, is these factors here in vocal hygiene, how to take care of your voice. So there's systemic hydration, drinking plenty of water. I've got my water bottle right here. And there are different schools of thought. It used to be drink half of your body weight. If you weigh 100 pounds, you should drink 50 ounces of water. If you have kidney disease, there are lots of factors that might mean you wouldn't want to do that. You need to stay well hydrated. Systemic hydration is different from surface hydration. Surface hydration of the vocal folds can go a long way toward helping them not fatigue as easily. And the only way to get that is to breathe moisture. So I sleep next to a little humidifier that looks like this. It puts out a little bit of mist right here. It's cool mist. I can clean this easily with some peroxide once a week. And I sleep next to it because whether I'm in heat or air conditioning, those systems are drying out the air that I'm breathing. So it's really easy to light, get enough moisture just in my immediate area. My voice is much better the next morning. The amount of sleep you get plays a big role in your voice. Doing regular warm-ups and cool downs. And I've seen lots of vocal injuries for people that say, I didn't have time to warm up. So in my studio or in my voice therapy regimen, you learn a 9-minute warm-up. And I learned that everyone will do 9 minutes. And as soon as the number switches to 2 digits, 10 or above, they'll tell me they don't have time. So at the very least, you can warm up your voice. If you drive to work, to teach, warm up in the car 9 minutes. It's better than nothing. And certainly for those of you doing singing roles and rehearsals, if you could cool down for 5 or 10 minutes afterwards, we'll talk about how to do that. Your general physical fitness plays a big role. Limit your voice use to only what you are paid for. I've said that a few times already this morning. And take some voice naps. If you're a person that has lots of social connections that you meet, as you and I are meeting now online, you may need to say to your family, for instance, I want to talk with everybody. Let's have a quick meet and greet, and then follow up with some details about how we're going to get together Memorial Day weekend with email. And then what you eat. And I'm not well qualified, but I can tell you it plays a big role in your energy level, how your body metabolizes certain foods, and there are lots of good resources for that. If you only take a picture of one slide, this might be the one to consider. The greatest risk of injury for performers occurs, number one, when you're changing a technique or using a new instrument. If you were trained in classical singing and you're crossing over to R&B, you are at a higher risk of injury while you're learning the differences and the similarities in those two. And then with prolonged practice without enough rest. You know, this would make sense to you if you were an athlete that's paid a lot of money in a major league sport, that you wouldn't want to practice too long, especially if you're making a change from one position to another without enough rest. But somehow we think with our voice, we can just do it all. So I've seen students trying to memorize their repertoire the night before the jury who just keep practicing and practicing and practicing it. And they might get to memorize it enough to get through the jury the next day, but they may not sound as good, or they may be actually hoarse from prolonged practice periods. And certainly for someone who's had a vocal injury, they may want to practice 30 minutes a day. We start with 3 10-minute practice periods. When they feel comfortable with that, we go to 2 15-minute practice periods before we bump up to 1 30-minute practice period. So if you are preparing for a role and you know you're stressed and tired, maybe you're not eating or sleeping well, you could break up your practice periods and still get the same total number of minutes, just so that you don't risk an injury. Other risk factors: temperature, the space you're rehearsing in or living in. If you go to work on a contract for Tri-Cities Opera in Binghamton, New York, and they put you in a home with 3 other singers, you may not have control of the temperature, or the space might be old and not cleaned very well. So now you've got allergens and irritants. So these are things that you would have to figure out how you're going to manage before you get there. Other physical demands: awkward postures and positions. I had to sing an aria from inside a burlap bag lying on my side. Just my head was sticking out. That's what the director wanted. Wasn't an ideal posture, but I had to figure it out. Forceful exertion, heavy costumes or props. One time I had a costume that weighed 30 pounds. And so I had to practice on my own wearing pieces of that costume as they would allow me to take the pieces in and out to get used to the demand on my body in that costume. Repetition, long duration activity without enough rest, and just the vibrational forces. You use more medial compression of the vocal folds to be loud than to not be loud, but it's also not healthy to kind of get breathy and think you're saving your voice. That's a maladaptation. Your personal characteristics: how's your posture? How's your overall strength and flexibility? Are you a person that tires easily? Comorbid health conditions that we touched on earlier can make a difference. Eating disorders has become an issue that we are dealing with in the voice world more than we ever have. Definitely plays a role in how much stomach acid comes around the vocal folds for those who vomit, and general health is affected. Your nutritional status, and how do you deal with psychological stress? And you're going to have ways to deal with some of these issues later on today. So voice problems can be a result of incorrect posture. And two things I just want to talk about here. Hip flexion can be helped a lot by working on the psoas, which we're going to do in a moment, PSOAS muscle. But look that up. Look up exercises for the psoas, because we are a sitting society. And the more you sit, the more those psoas muscles don't get exercised enough. It can impact the breathing and the overall posture, especially in the hips and torso. And then forward head posture has become very prevalent. So if I'm texting, my head is down, and I'll show you, I'm going to start with my head in a neutral position, and then I'm going to push it forward and let you hear what happens. And if your neck muscles become accustomed to that forward head posture because you sit at a computer all day, or you do a lot of texting with that head fully extended, those muscles get tight in the back of your neck and overstretched and compressed in the front, and it definitely impacts the larynx. An incomplete or inappropriate technique for the vocal demand of a role. Again, many singers stop seeing a teacher once they get the role. And I would have to say, of all the genres of singers I've worked with, which is every single one you can think of, I think, oddly enough, the most vocally demanding one is the wedding band singer. I've seen more vocal injuries in that group than almost any other. And I don't know if it's because they're asked to sing so many styles, and often they'll have to learn songs quickly that are specific to that couple for whose wedding they're singing. Or maybe it was something grandparents had at their wedding and they want the wedding band to do it. Or it was a song they heard on their first official date. I don't know, but often the venue is loud and the singer can't hear themselves well. They don't have good in-ear monitors, so they strain their voice over the course of 3 or 4 hours. So that would be the excessive force and the vocal overuse. And when we say vocal overuse, we are really, in my industry, measuring duration. How long did you use your voice? Frequency, and that has to do as much with the pitch range as anything else. And intensity, how loud were you for how long? Over what period of time? And then insufficient vocal rest and insufficient body rest. So I treated a number of people in The Lion King, and you would see from these photos that every character wears a headdress and every character wears one of these corsets. And the medical practice that I worked for, one of the doctors had really go to bat with the producers of this show to say, those corsets are very confining for rib cage movement. Can you at least put some Velcro in them? Every show has different rules, but many of the shows have this is not the official term, but I call it the you can't gain weight rule, which is if you gain more than 5 pounds, they will not alter the costume. So if you gain weight, you still have to fit into the original costume that they gave for you. So it really makes it difficult for singers to get very far off course, because their goal is, what does the show look like? This is how we want all the singers and actors to look. So you might know your role really well, and they put that headdress on you. Some of these also have heavy collars. You can see the character seated on the left of the screen also has a collar, and then these corsets. And so that's a learning curve for many of the performers in this show, not to mention that it's a physically active show. This is a staged production of the opera Rigoletto, and the actors are on what's called a raked stage. So their balance is very different than standing in a practice room on a flat floor singing, and they're out over the water. I'm sure they have safety measures in place, but it looks a little scary. And then outdoors, you don't know what the humidity is going to be, what the temperature would be. And you can see on top of the clown's head in the middle, the large stage, there are people up there. I don't know if they're singing or not, but that might not be the most comfortable place in the world. So this show would have a learning curve on how you use your body, regardless of how well you sing the role. Let's do a couple of things. First of all, before I teach you the tongue resting posture, I want you to make a U with your finger and thumb and grab here. This is that area of the hyoid bone. And we're just going to go in circular motions. And I invite you to let your jaw drop open and your tongue rest forward like this. And then we're just going to move down. And you can feel for any tension in these muscles. You can pull in a downward motion. And the other one is to do 3 fingers and move back and forth. You might hear a little clicking. Once in a while, I can really feel the stretch on this side, but for me, the right side gets tight sooner than the left. So if I'm in a choir rehearsal and I'm singing in the soprano section and the director stops to work with the basses, I might reach up and do this. Just a few seconds, so that any muscle tension I've acquired so far in the rehearsal, I can get rid of and not continue with. All right, the tongue resting posture is there. It turns out there is a correct tongue resting posture, and 2 out of 3 people automatically do it right, and the other 1 out of 3, which was me, do not. So I'm going to teach it. Slide the tip of your tongue up the back of your upper teeth. And where the enamel of your teeth ends, there's a little bumpy ridge of tissue called the alveolar ridge. And that is where the tip of your tongue should rest. And the rest of the tongue should, if you've got that tongue tip on the alveolar ridge, the rest of the tongue should relax in a downward position. And anytime you are listening, whether you're listening in a class, listening to instructions from a director or a conductor, listening to music, television, movies, Netflix, whatever you watch, anytime you're not actively talking or singing, this should be your tongue resting posture. So not crammed behind your lower teeth. For many people, the tongue is much bigger than what their lower teeth contour can accommodate, and so it causes a tongue bunching back here that leads to a lot of tension here. So get your tongue resting posture, and you'll also notice you cannot clench your jaw when your tongue is in this posture. If you're a person that had your tongue glued to the roof of your mouth, you probably had your teeth clenched. But if you can get this new tongue resting posture, you've relaxed your jaw in a good way. Okay, now let's try those together. Get your tongue resting posture and do your laryngeal massage. Piece of cake. But it's a way you can check in with yourself. If you are in a school setting where you change classes frequently and you get to the next classroom 2 minutes early, get yourself settled, check your tongue resting posture, and do a minute or two of this. A moment or two. Works great. Okay. Next. We may not watch all of this, but I wanted to show you at least a little bit about some exercises for the psoas muscle. Again, this is on YouTube, and there's the correct spelling of psoas. There's an excellent book that I recommend on this called The Vital, V-I-T-A-L, psoas, written by another PAMA member. She's really an expert in how this affects performing. So we can watch a few moments of this.
In this video, we're going to go through the best psoas stretch that I usually give a lot of my patients. When you do a psoas stretch, the stretch that you usually see is like this exercise right here. Now, this is a stretch that I give a lot of my patients that are athletes or somebody a little bit more active. But actually, the best stretch for the psoas muscle is actually a lot easier than that. Because you got all these trigger points, you probably did a lot of the trigger point treatments, you're getting that pain coming down. The last thing you want to do is try to get a stretch that's going to over-exaggerate things and maybe actually aggravate those psoas and get it tighter. So the best exercise is actually lying down on the ground, keeping your knees up, and what you want to do from this position is you want to flatten your back. You kind of flatten your back and kind of, instead of lifting your butt up, you just kind of move your pelvis forward. And you're going to hold that position. And when you hold that position, it actually does give you a good stretch of that psoas muscle, but it's very subtle. You're not going to feel a huge stretch. The best thing about this exercise is you want to work this up to about a minute, 2 minutes, 3 minutes. Work all the way up to about 5 minutes just lying down and doing this. And you're going to start seeing some significant results with that psoas muscle. Now the psoas muscle attaches from the low back. It actually goes through the body, the abdomen, and attaches right here. So it's called a hip flexor. So when we press that back down into that ground and we bring our pelvis up, we're going to be stretching that muscle. A lot of you who are a little bit more active, you can do that other exercise if you like. But in my experience, I've always found that if you got trigger points in the psoas muscle, this very gentle exercise is probably the best exercise to do.
Great. So we can stop here from the video. What I wanted to say about it is if you are in a practice room situation, you could give yourself a 3-minute voice break and lie on the floor of the practice room and do this psoas stretch. And it would still be so helpful. It would give you a voice break. It would let you stretch that psoas and keep in touch with your body in a really good way. Here is just kind of a funny graphic, but it actually is accurate information. In the first picture, if your head is at a 45-degree angle, your head feels to your spine as if it weighs 49 pounds. And the more bowed your head becomes, the greater the weight feels. Of course, it's not going to fall off, but I think that we see a lot of people in our culture with any one of these head postures, and it's just something to be aware of. If you're in a situation of touring, you need to look at these things before you go. The vocal demands of the role, what is the range, and the tessitura, and those are similar but not the same. The range is what is the lowest note and what is the highest note. The tessitura is where does most of it lie. If my range as a soprano of this particular song or aria, or if I'm in musical theater, same thing, is the G below middle C to the C 2 octaves above middle C, that's a very large range. But if the majority of the song lies between middle C and then 1 an octave higher, that tessitura is going to be less vocally taxing than if the main part of the song lies between the C, I call it C5, above in that area and higher. It's going to wear my voice out sooner. So you not only need to know the range, but the tessitura. What is the total vocal load for speaking and singing? If you are the only singer in a rock band, then that's a very high vocal load. You sing every song throughout the show or throughout the set. If you are Susanna in The Marriage of Figaro, it's one of the longest soprano roles in the literature in terms of how much she sings and how much she's on stage. The other thing I put on that sentence is press. Are you in a band, or are you an up-and-coming singer or a famous singer whose agent wants you to go out at intermission and sell recordings and T-shirts and make a quick appearance? That's vocally demanding. And we now know from all the COVID literature that's often where you can pick up a cold or some other disease, is doing the press at intermission or after the show. The other definition of doing press is I've had a number of rock musicians or country stars who are asked to do the morning radio show the day of the show that they're going to do. And maybe they got in late the night before from another city, and now they have to have their voice warmed up to do a radio interview at 8 o'clock the next morning. That counts as vocal demand. What are the physical demands of the role? What's the choreography? Do you have to be in a harness? Do you have a lot of lifting, either of pieces of the set or of a partner, a dance partner? What postures are you in? Do you have to play an instrument? I had a really wonderful soprano who had not one vocal issue until she got in a show where she had to play the violin. Because she listed it on her resume that she was an accomplished violinist, they threw it in the show, they wrote it into her character, and now all of a sudden she's in this position. Sing, 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 play. Sing, 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 play. So that was something that had to be dealt with. There are venue challenges. Outdoors, we looked at the Rigoletto set. Maybe you're in a black box theater. Maybe there are a lot of heavy curtains that absorb the sound so you don't hear yourself as well. You could be in a large arena or proscenium stage. And depending on how the set is designed and how the director places you on that set, you might have some challenges with your voice. We've already talked about a lot of these. Role preparation and how to mark. And if I could ask the teachers listening to this to teach your students how to mark in a healthy way, not under-singing and being real breathy, and learning when to take the high notes down an octave, because the real purpose in some of the repetition of staging during a rehearsal period is just so the singers can learn their places on stage. You don't need to give 100% of your voice every time. You might even speak to the stage manager and say, I'm going to be marking today's rehearsal, but please tell the maestro I'm happy to sing out during the final one if they'll just tell me. Role preparation, divide your role into manageable bits and pieces and learn it in stages, but then learn to put it together. How to manage a director's request for vocal production. So going back to The Lion King, the musical director in that show requires straight tone singing from every singer. And they will talk to you in your head mic and say, I heard vibrato, or they'll give you a note after the show. So how are you going to manage that vocal production and still be in that show? You have to figure it out. You own the voice. I won't go through a lot of this, except there's a little bit of history of somatic organization. How do we sense ourselves in space? And of course, adding the voice piece to it. And the real pioneers here were Mabel Todd, her dates are there, F.M. Alexander, who developed the Alexander technique, and Moshe Feldenkrais, who did the Feldenkrais technique. All of them emphasize the importance of understanding the human body mechanics. All of us have to deal with gravity and other external forces, and no segment of the body can adjust without move without adjustment of the rest of the body. And you just heard me do that with the forward head posture. And if I were there with you in person, we'd do a few more things to demonstrate this. But if you move to the next slide, Feldenkrais said, and he's not the only one, but this is a very succinct way to put this for today's purposes. You really want the body to initiate movement in any direction with the same ease, without a preliminary adjustment, and perform the movement with the minimal amount of work, maximum efficiency. So if you know that you have to fall or jump from a table to the floor as part of your role, you're going to want to rehearse that at home to figure out how you can make that efficient with the minimal amount of work. You get the direction from the director and you work on it on your own, and then you try to get on that set and apply that so that you're not tensing your neck or pulling your head back if you don't really need to. And that's what learning this somatic body map is. When you become a teacher or you inherit someone who has been using their voice for a long time, they come to the singing experience already with a map in their brain. It's habituated through the nervous system, but it's also shaped by physical and emotional responses. So you, as the guide, whether it's a voice therapist or a teacher or a vocal coach or a director, have to know that this is already in the person and try to learn what they have so you can learn what's efficient about it and what could be more efficient about it. These are largely known to most of us, but it bears saying that they may have some somatic blocks. Sometimes they're unaware of the blocks. So sometimes doing a short video, I'm not a huge fan of videoing every lesson because singers by and large are self-critical anyway. But I do sometimes point out, do that again and let me show you from the side what I'm seeing, and let's see if we can work to make that more efficient. We've talked about these three subsystems working in concert already. So I say to my patients, we're going to be doing 6 or 8 sessions of voice therapy. And I'm going to tell you from the beginning, it would be easier for me to teach you to write with your feet than it will be for us to work on your voice. And that's the reason this first bullet point is here. Somatic learning is relatively easy when you're learning a new task because your brain doesn't have any experience with it. It's more challenging when we're changing a habituated movement, or in our case, a somatic map of how to use the voice. You cannot easily change what you do not sense. And in my field, it's if the patient cannot hear the difference or feel the difference, I have a lot more work to do. It's much harder for me to work with them. Not impossible, but it's more challenging. So, you know this already, the nervous system requires on input for our senses and movement to orient us in space. And so we're going to be adapting established patterns for new tasks. And if you change from one style of singing to another, that's what you're doing. But you have the somatic map for the first way you were trained. So that's just having that knowledge kind of helps you figure out why it's not always easy, and singing in one style may not easily transfer to another style. I think this might be the last slide. You may know a lot about semi-occluded vocal tract exercises, but if not, that's the official name for lip trills, straw exercises, tongue trills. But you may not know why they're good. So that's what I've put here. They facilitate less impact, pressure, and collision forces on the vocal folds while still getting them to stretch in a balanced position. So if you do nothing else to warm up or cool down, an SOVT exercise would be good. So I'm not going to do a straw in the water here, but those are good too. Lots of versions of these exist on YouTube, but we're just going to try some lip trills. I have to moisten my lips a little bit, and we'll do 3 versions. So the first one is this. And I'm just letting air move through and vibrate the skin of my lips, but I'm not engaging my vocal folds. So let's try that again. Next, I'm going to hum one note. You may pick the single pitch. I wouldn't pick my highest or my lowest, somewhere in the middle, while my lips are vibrating. So if you've ever read a story to a child, this might be a motorboat that you would do. And the last one is pitch gliding while my vocal folds, my lips are, and my vocal folds are vibrating. And if you could just go through your morning routine of getting dressed or while you're driving to work, the New Yorkers do it on the subway because they don't really care what people think, but just the way to warm up. So just 2 or 3 minutes of that will help your voice warm up in an efficient way without the overlay of words, rhythms, specific notes, emotion of the song. Without all of that, just getting the instrument itself warmed up. Let's see if that was the last slide.
Sorry, it took a while here.
It's okay.
Yeah, that was the last slide. That was fantastic. Thank you, Dr.
Thanks.
Thompson. So I want to see if we can take. I'm looking through the chat here and see. By the way, we're so fortunate to have Dr. Diana Lee, my wonderful partner here with me, because she is a nutritionist specialist. And indeed, and she has some wonderful workshops and materials available for nutrition and healthy weight in our
Great.
holistic arts and wellness program as well. So we are, let's see, I'm just looking to see if there is, let's go into the chat and see if there are any. I don't see any questions here, but I'm wondering if we can open it up to our audience maybe. And I know maybe Dr. Diana Lee would also like to do something. So can we maybe put the mics on that are, and unmute ourselves, and can we turn them on? Sorry, virtual audience. And I want to thank you for being patient with us. And I just want to say, if anybody, please, we have about 15 minutes here, and we're so fortunate to have Dr. Thompson with us. So virtual audience and in-house audience, please, would the virtual audience please put your comments or questions, I should say, in the chat, and we will take them. Anybody in the audience here, please? Oh, you did post. Oh, I'm sorry. Oh, you did. I thought it was a comment. So let me put it up actually so we can see it here for everybody. And I'm going to read it if it's okay. I really enjoyed your presentation. Never knew the resting posture of the tongue, and it is already making a difference. That's actually a comment from one of our listeners on virtual. So let me put the comment up from Dr. Lee. For individuals that talk a lot for work or continuously do presentations, what can they do to minimize damage and improve performance? What an excellent question. Dr. Thompson?
So I would say that surface hydration is really important between gigs. If you're going from one presentation maybe to a meeting or a conference call, if you have a way, there's some very inexpensive ways, but there's also something expensive like the My Pure Mist, which is a handheld thing that allows moisture to get on the vocal folds quickly. The Broadway singers, almost all of them, use something called a mesh, MESH nebulizer. They're available online. They're kind of really used for asthmatic people, but if you don't put medicine in them, you're just inhaling water. And it's a very quick way to get a hit of moisture to replenish those vocal folds, which have gotten a little bit dehydrated in use. I also have worked with a number of public speakers and presenters, even TED Talk people. In New York, I had people that were on MSNBC all the time, on how to pace the presentation and maybe tweak the order of the slides. You'll notice in my own presentation today, I had 2 breaks for videos, and that gave my voice a break, even though I ended up narrating them a little bit. If you can intersperse that, it's more informative for your audience, and it gives you maybe 1 minute of a voice break. If you teach classes back to back, which a lot of universities have gone to, they'll give one instructor a classroom for 3 hours because it's easier for the university, but they don't realize what the vocal demand is when they do that. So I worked with an ear training professor, and we were able to really tweak how much she sang and how much she could just let the students do it. It became part of their daily grade to lead the sight singing. So it gave her voice a rest, and it also made the student more independent, and they all knew they would have to do it. So it wasn't singling anyone out. And I think learning how you can tweak your own presentations. I would also say if you can say it in fewer words and then wait for questions, it engages your audience more. If you're speaking to 5,000 people, that's not very useful. But if you're in a classroom setting or a lecture hall, we all of us who teach love our subject. And so it's easy for us to get very verbose and talk more and more about it. But try a semester or 3 classes of a semester in saying less and waiting for them to ask you for more. And it will save your voice, and it might make you more versatile as an instructor.
That's a great comment. I'm going to need to take coaching lessons from you. So we're going to have one from the audience, from Mr. Ram, and then I'm going to put another one from the virtual audience here. Mr. Ram, please.
Good morning, Dr. Thompson.
I didn't hear it.
Oh, sorry. I probably need to unmute myself. Can we try that again? Sorry, Mr.
Hello,
Ram.
testing.
Can you hear that?
Are you there?
Okay. Great.
Yes.
Yes,
Okay.
sorry.
Hi, I'm Curtis Ram. I teach voice here at Bethune University, and I've had a career as a singing actor in opera and Broadway. I would like for you to speak to the demands on the different languages and the vocal technique.
Terrific. Well, I used to teach singers diction, and often the order that we would teach that in was geared toward the languages that were easier from the demand on the articulators and the vocal system. Very often we started with Italian, mainly so they could learn the IPA. Sometimes we would start with English, and if it's the native language for a singer, it's easy. If English is not the native language for the singer, it's not easy. Okay, so I think the more you know about each phoneme, the better you have control of that. Here's an example. When you have to put together lots of voiced and unvoiced consonants, which happens constantly in our language, you're turning your vocal cords on and off, on and off. So if I'm using the word elephant, the the first phoneme is voiced, the ul is voiced, the is voiced, but the next phoneme, which is spelled PH, but it's actually pronounced as an F, unvoiced. The next vowel, whether you say it as an a or an is voiced. The n is voiced, but the t is not. So in that co-articulation, I'm asking my articulators are moving constantly, and my voice is on and off, on and off. If I have to sing that word, I can't think of an instance when I might, but I'll use it as an example. And the tessitura is really high or the note values are really long. One way I might make that more efficient is to voice the F, it would become a V, and to voice the final T, it would become a D. So knowing those voiced and voiceless cognates, which you would learn in Singer's Diction, but if you don't take Singer's Diction, there are lots of ways to learn it online. You can write to me, I'll send you a cheat sheet. I use it all the time with singers in auditions. If I sing elephant and I have to turn my voice off twice, and then I go to elephant, I've barely voiced the F as a V. That was a little more obvious, but the final T being a D wasn't. And that allowed me to keep my voice on the whole time. So if you have a word like hallelujah, that's continuous voicing, you don't have to worry about it. But in lots of the words, especially if they're very fast, another 100 people just got off of the train and came up to the ground while another 100 people, it's impossible to figure out every word, and you don't need to substitute the voice cognates in every situation. Only those areas that are giving you trouble, look at the phonemes. Are they voiced or unvoiced? If they're unvoiced, can you voice them gently and leave your voice on? And that might help. That's one way I can think of to address the languages. Certainly, different languages like French has the nasal vowels, which we don't necessarily identify in English. We have them, but we don't identify them that way. So that's a learning curve for a student, a learner of singing in that language, to learn how to even access. We have in English, and then I just nasalize it, But I have to go through those 4 nasal vowels with a lot of the students many times for them to even experience it. Because what I learned as a speech pathologist, when we are learning language, which is in the first year of our lives, if we don't hear we're born with the ability for every phoneme in every language. If we don't hear them in our environment, we forget them. So now we're at 18, 19, 35 years old learning it for the first time. So if you have the advantage of a bilingual or trilingual home, do it, because it teaches the child all of those phonemes that are in one language that are not in another, and it makes it much easier for them. So part of it is experiencing the that you might have in German. We don't voluntarily have that in English.
That is such a great comment you bring up, Dr. Thompson, about also just hearing and learning, right? We all forget about that. And before I take the next question from the chat, can you actually talk about that? Because that just made me think about what impact does all our social media and texting, where we basically don't talk anymore at dinner tables, right? And so on. And even in the house, I hate to say it, I see so many parents. I'm sure they have wonderful intentions, and I've been there. I know they need rest from their kids, but I see them putting them in front of that tablet. And the point is, they're not hearing language and live spoken language. Can you comment on that, please?
Yes. So it's so important as children are learning to read social cues. If you're sitting across the table from someone and they're yawning, to learn that means either they're really tired or they're really bored, but they might not actually be listening as well to what you're saying. To learn when you've said enough, reading those social cues, reading the body language. And in social media settings, they're not getting a 3-dimensional picture of anything or even a three-dimensional auditory experience. They're getting what the social media platform magnifies. And so learning the nuances, which makes such a difference in live theater, even on film, in how you interpret a character and how you learn something about that character. If you've never had the experience, it's much harder to interpret that character when it comes time to do that. Traveling, certainly you learn the customs of a different culture, even within the United States, different areas of the country. I'm currently in Boston, and I'm in a town near Boston, in a town called Gloucester. But I don't say it like they do. They say Gloucester. But so if I'm speaking to a native of this town, if I say Gloucester, they'll know. They call me a washashore because I came aboard at a different time than they did. And so learning those cultural differences, learning the rich language, and even how someone says something. If I say to you, "How are you doing?" and you say, "I'm great," I'm going to interpret that differently than if you say, "I'm great." This smirk and this shoulder and my tone of voice told you that the second "I'm great" didn't mean the same thing as the first "I'm great." Same two words, but learning how to interpret that is what I think is really missing, just in the way that things are currently in our society. And it shows up in a lot of ways, but I think in the singing studio and in interpreting these acting roles, singing roles, film roles, makes a big difference.
Okay, thank you. That's great. We've got two quick questions. I know we're running out of time, but here's one from Dr. Lee again, actually. What is the effect of smoking on the vocal cords? I'm sure that can be a 2-hour conversation, but can you briefly, and I'm also going to throw in there, if I may, also, what do I want to say? Recreational use of certain drugs. How about we add that in there, please? Thank you.
Great. Okay, so at its core, smoking anything is drawing in a hot, heated up substance across the surfaces of your vocal folds down into your lungs. And then as you exhale, it's coming back up and going out. So it has exceptional drying effects for the vocal folds, and depending on what you're smoking, chemical effects. In states where marijuana has become legal, there's actually that makes it somewhat easier to know what it is you're smoking. But for many years, I've treated, again, lots of rock and roll singers, and I long ago stopped telling them, please stop smoking pot, because they're not going to do it for the ones that really love it. So we have found better ways for them to use it, such as nebulizing it, baking it into brownies or cookies. That's at least not drying their vocal folds out so much. But knowing the source, if you're not growing your own, you don't know what's in it. So there could be fertilizer, there could be, insect repellent that you're heating up to a very high temperature, and now you're ingesting that. I would almost say the same thing about essential oils, though, because we don't know how the lungs process those oily particles if you're sitting next to an essential oil diffuser. So when I use one in my house, I put it in the kitchen and I enjoy the aroma in a larger space, but I personally don't sit next to one because I don't know if my lungs can process those oily droplets or not. I think there hasn't been enough research on that. So for me, just breathing water, just plain good water, is the best way to hydrate. Certainly the other effects of any drug, including alcohol, is that it's it changes your biofeedback system. So you might become louder. You might think of yourself as funnier and more gregarious under the influence of something. But that could cause you to use your voice more for a longer period of time in a loud setting and be less able to self-monitor. So choosing when to do that, not after every gig if you're on a tour, if you can help it, do more on the day off. I would love to sit here and say don't do it at all, but I have to also work with the realities of what we have to work with.
Thank you. I'm going to put up two, if we may. I know we're running a couple of minutes late, but these are important. Here's one. I'm a teacher that cross sings between classical and R&B, but I have been experiencing problems with voice lately. Haven't been able to have regular lessons. Who should I seek for help from first? I think we addressed it, but maybe you could just remind us, please, Dr. Thompson.
I would say, I don't know where you live, city or state, but I would say start with an ENT. And if they feel you need a laryngologist, you may have to travel to a nearby city, but it's never wrong to get your vocal cords looked at. You may only need 2 or 3 sessions with a voice therapist to get some ideas about the direction to take yourself. But we're going to ask you, when did this start? Has your range changed? Has your duration of time you can sing without vocal fatigue changed? If you're female, we might ask you where you are in a hormone cycle or in a life cycle. Are you middle-aged? We see some changes around age 35 that are hard to pinpoint. So there are lots of ways we could help you. Certainly, if you have access to a singing teacher that you could say, could I just meet with you for an hour and get your ideas? Try it.
Thank you. That's great. And last one, and we have to unfortunately cut it there, but this is an excellent one having to do with acid reflux. Are there any vocal exercises you would recommend for someone experiencing symptoms of acid reflux and loss of normal vocal range? Excellent question. Thank you.
So I purposely left reflux out because I'm not a doctor, but I will tell you that reflux does play a big role in voice. Some doctors think now it's being blamed too often for voice problems. So the first thing I would do is get looked at by a doctor to see if there's any overt evidence of reflux. We don't always see it in our work. There's a really good book, there are probably several, but the one we recommend the most is a book called Dropping Acid, bestseller on Amazon. The doctor is Jamie Kaufman, Koufman. She has done all the research on alkaline water. She pH tested all the foods that she listed there. There's a diet you can go on for 3 weeks that will let reflux wash out of your system, and then you start adding some foods back. But it does play a role, and specific voice exercises won't necessarily fix it until you address the reflux aspects. Dr. Lee may have some more insight. I will tell you a product, and I rarely recommend one, but this one is called Reflux Gourmet. And it's 2 physicians and a chef, and it's all natural products. There's no medicine in it. So if you're a person that has tried reflux medications over the counter and you're not getting much help and you're waiting to see a doctor, you could order this product. It's in a tube. You squeeze it in a teaspoon. I take the vanilla caramel. It's an alginate product. The algae forms a flotilla over your stomach contents. You can't reflux through it. Dr. Ramon Franco, who's at the Massachusetts Eye and Ear Infirmary, is one of the inventors. He's one of my former bosses. I had a long discussion with him about it in October. And that's something you could try over the counter that's not a medication. It's not going to cause osteoporosis and some of the other side effects that long-term use of over-the-counter drugs can. I'd be happy to present some other time on reflux. It's a big subject.
I know. I know, Dr. Thompson, I'm so sorry. I know we could go on asking questions, but we've got to unfortunately move on and because we have a short break before the next one. But thank you so much. I
Thank
know
you.
here in the audience, everybody's applauding. And I just want to just tell the virtual audience, we're going to be promptly back at 10:45 with our next presenter, Miss Ashlee Hughes, the music therapist. And if you're at home, just have a spoon and a bowl or some kind of percussion type simulation that you can do because we're going to do some interactive stuff. But thank you again. I know everybody's giving the
Thank
thumbs
you.
up to Dr. Thompson's. Thank you. And I'm going to put the music on.
Okay, I'll take this for this session.
Okay, I think we are just about ready to start here. This is for our virtual audience, and we're going to swap this out. Great. And Ashlee, if I can have you stand a little bit further back, believe it or yeah, otherwise, and maybe we just move the stand with the mic. I mean, with the iPad so that we can, yeah, this is actually perfect. We can see you. And then let's go ahead. Let's test the button, the second mic. So can we, Dr. Lee, can you just test the mic, make sure it's actually, yep, it's on. So I'm going to turn it over to you. Dr. Diana Lee is going to introduce Ms. Ashlee Hughes, our music therapy phenomenal interactive session. And as I said before, if I may just briefly remind everybody who is virtual, grab a spoon and a bowl. Am I right, Ashlee? For percussion. And as I said, we'll do a phenomenal interactive workshop. Thank you.
Ready? Very good. So Dr. Diana Lee, it is my pleasure. individuals with diverse needs, combining, music and all of that wonderful art.
Quite. Okay. Let's try that one more time, please. Let's make sure we can.
Testing, 1, 2.
Okay. I think we should be good now. Thank you.
Gotta love live, right? All right, awesome. I think just about everybody has a music therapy packet. So I'm only going to spend about 15 minutes or so cramming my entire career into 3 pages, which is really hard. Sometimes I do workshops for entire days. So, but I wanted to give you guys a little brief introduction to music therapy. So how many people have heard of music therapy? Okay, good. Most people have heard about it. Has anybody ever experienced or seen it before? Yeah, not very many. So at least you've heard about it, not everybody's experienced it. Good. That gives me kind of an idea of kind of who's it for you guys. So music therapy. Most people think, when they think of music therapy, oh, do you play music and people just feel better? And yes, we do, but there's a lot more scientific approach to it as well. So I'm going to share that with you guys here today. So what is music therapy? So here is the official definition of music therapy. So music therapy is a clinical and evidence-based use of music intervention to accomplish individual goals within a therapeutic relationship by a credentialed professional who has completed an approved music therapy program. Music therapy interventions can address a variety of healthcare and educational goals. So that's the specific, exact definition of music therapy. My definition to you is that music therapy is a combination of psychology and music melded together to reach non-music goals through music. So we're using music as a tool to work on non-music goals. And you notice that our definition is very broad, and that's because music therapists work in so many different places. So they make it very broad to encompass a lot of different goals because we really can work on a lot of different things. So the history of music therapy, there's a little blurb there, but I'll just tell you quickly. Basically, music therapy came around after World War II, and the musicians were coming in to play to the vets at the hospital, and they realized that the music was helping them feel better. They realized that they were feeling better, that their spirits were lifted, that their pain was lessened with music. But then we realized that these musicians didn't have the psychology background to help them with their coping, to help them when they had a panic attack, to help them work through some of the things they might have seen in war. So that is where music therapy was first created, when they realized that these musicians needed the psychology background as well. So they melded the two together to create the field of music therapy. So this field is pretty new. And myself, I've been a music therapist for 15 years, and I'm actually a second generation music therapist as well. So my mom has been practicing since the early 70s, and just like me, she went to Florida State University as well. So it's been really interesting over my lifetime to see how incredible music therapy has been and also grown. When I was a kid, most people, said, oh, what does your mom do for a living? Oh, she's a music therapist. And people are looking like, what is that? So at least most of the time when you meet people like you guys, at least you've heard of it now. So we've come far, far away. There weren't a lot of jobs in music therapy when I was younger, but now there are quite a few all over the country. So we're really proud to see our field expand and grow and make a difference with music. So who can be a music therapist? So a lot of people think that, just playing bedside music in the hospital or in a nursing home might be music therapy, but it's actually not. It's fine for musicians to come and play for people, but they're not really music therapists. So to be a music therapist, you do have to go to an approved college. You have to get a bachelor's degree or a master's degree in music therapy. You have to complete several practicums, and then you have to complete a 6-month full-time internship, which is a lot. And then after all of that, you can sit for a board certification test. This is like a 3 to 4 hour test that includes multiple choice and writing. It's pretty hard to test. And once you complete that, then you can receive your MTBC. So that's what I have after my name. It's Music Therapist Board Certified. There are a few other certifications that you can have as well. So I have some expertise in NICU music therapy and also speech and traumatic brain injury. I've worked in a lot of different settings. So music therapists really do a lot of different things. So I bet you didn't know that music therapists had to do so much, right? All right, so on to the next page. So where do music therapists work? So that is a loaded question because really it could be beyond some of these places as well. But some of the most known places are psychiatric, mental health agencies, rehabilitation centers, daycare facilities, nursing homes, schools, private practices. I've experienced also working in hospice as well. And we work a lot with kids with special needs and mental health challenges in our business at Beachside Music. So what does music therapy look like? So music therapists assess emotional well-being, physical health, social functioning, communication abilities, and cognitive skills through musical responses. We design music therapy sessions for each individual or group based on their needs. So a music therapy session could, of course, look like singing and playing instruments, but could also be music improvisation, receptive music listening, songwriting, lyric discussion, music and imagery, music performance, and learning through music. And we also usually participate in interdisciplinary team planning. So when I was a hospital music therapist for many years, I would go to the meeting with the doctors and the nurses and whatever therapists, physical therapy, occupational therapy, speech therapists, and listen to the goals that they had for them. And then think about how I can use music to help them reach those goals, whether that was regaining their speech or regaining some of their motor movement. I know, can you even imagine motor movement and music in a hospital? So I'll never forget, playing the drum down the hallway and helping people with their gait. When you use rhythm, your entire brain is engaged, even the part you use for walking. So we're using a rhythm to help them have a more even gait at the hospital. So here's me with the drum, helping people regain that rhythm that they need to walk again after being in a traumatic accident or something like that. Same goes for people who have had like a stroke or traumatic brain injury. I don't know if you've ever seen someone who has dementia, who don't know their family's faces or names, but they can sing familiar songs. Have you guys ever seen any of those videos like that before? Pretty awesome. And also, people who stutter, but when they sing, they don't. And so the reason why that happens is because music is in all parts of your brain. So no matter what part of your brain is affected, you still have music there. So speeches are one part, music isn't all. So what we do is we use music to bridge the gap from whatever part of the brain is working back to the speech. So we're helping with speech and then fading the music. So I put a little quote down there. I said, almost all people respond to music. Music is an open sesame. If you can use it carefully and appropriately, you can reach into a person's potential for development. So that's really, I think, encompasses what we do. So who can benefit from music therapy? If you ask me, I'll say everyone. course. Music can help all people, no matter if you have a special need, a disability, a mental health challenge, or not. So just a few of the people that we help are children, adolescents, adults, elderly with mental health needs, developmental delays, learning disabilities, Alzheimer's disease, aging-related conditions, substance abuse, brain injuries, physical disabilities, acute and chronic pain, and even we help mothers in labor. You can believe that, it helps with pain. I've done that several times in the hospital. Can you guys believe that music can help with all those things? Isn't that cool? Yeah, we love what we do. So a lot of people ask me, oh, well, is music therapy research-based? Absolutely, it's all research-based. So I put just a little bit of information about the American Music Therapy Association, and they say that evidence-based music therapy practice integrates the best available research, the music therapist's expertise, and the needs, values, and preferences of the individual served, which is really true. All right, let's switch over to the next page. This is our last page. This is a big one. So these are some examples of music therapy goals, and this really isn't even everything that we can work on, but I wanted to give you guys kind of a brief overview of some of the things you might see music therapists work on. So this is how we're using music, we're manipulating music and using it as our tool to reach non-music goals. So music therapists work with people of all ages, and we address limitations in non-musical areas, and below are just some of the examples. So you can see we work on communication skills, expressive language, receptive language, speech and verbal communication, effective use of nonverbal communication. We do all kinds of academics and behavioral skills as well. So the ability to imitate, comprehend written language, count and associate numbers. You can do all these things in music. So for motor skills, like I explained in the hospital, working on your gait training, or if someone has had a stroke and they have right or left side weakness, we're going to use an instrument on that side to encourage them to use that side. Emotional skills, so you can imagine how you can really express yourself through music, and no, you don't have to be a musician. People ask me that, do you have to be a musician to benefit from music therapy? No, you don't. You just have to be able to play a drum, or shake a shaker, or sing along. You don't have to really be a musician, and you don't even need to talk. So some of the kids that we work with are nonverbal, who have autism or Down syndrome or other special needs, and a lot of the times we teach them how to talk through music. So it really is a powerful thing to express yourself when you don't have words. Social skills is a big one that we work on in our business, because we work with a lot of children with special needs, and they need a lot of help with social skills. So, and actually we run a social skills class in our business as well to help people with social interaction with others, making appropriate eye contact, ability to touch others appropriately, willingness to be touched by others, ability to share materials and equipment, accept constructive criticism from others, make good choices, hopefully. The ability to accept praise and give praise to others, to decrease isolation. And that's a big one, especially in the hospital, I found is, especially being in Florida, we have a lot of snowbirds here, and their families live all over the place. So a lot of them don't have a lot of support in the hospital. They don't have someone to come and visit them. So, bringing music to them and talking to them and helping them cope is a really big thing for people who don't have a lot of visitors. So leisure skills, obviously doing music for leisure is an awesome option. Even as an adult, you can learn. We teach adults actually how to play ukulele in a class called Sip and Strum. So we really believe in teaching adults, kids, all ages how to play music, and it's not as hard as you think. At least ukulele anyway. So some other skills we work on, like I talked about, is to decrease pain, for pain management skills, promote independence, creativity, and self-identity. I could tell you a million stories about all these things, but I want for us to get to all the fun stuff. So now you guys are going to get to experience a little bit of music therapy today.
Oh, and by the way, on the bottom there, if you have any questions or anything, you can feel free to contact me. There's my phone number, my email, and here is our website. And it says, come learn with us. Internships are available. I have to put a little bit in there. And we're always hiring good teachers too. So that's just a little bit of music therapy as fast as I can possibly go. Hopefully that gives you a little bit of an idea of some of the things that we work on and do. So next up, we are going to do a lyric analysis. So I have some sheets for you. This is my awesome intern, Anna, by the way. Yay, Anna! Thank you for coming and helping. So she's going to pass out a lyric. I know that you guys online do not have this, but I bet you know the song because it's Don't Worry, Be Happy. So it won't be, it's nothing too intense or anything you haven't heard, most likely. So we're going to do Don't Worry, Be Happy, and then we're going to ask some questions about the song. So as a music therapist, we use lyric analysis for a lot of different things. But music really breaks down a lot of walls. So when I come into someone's room or I meet somebody new, they have a lot of guards up. They have most likely talked to a lot of other therapists or other people. They're tired of talking about themselves and what they're going through and how to cope better and things like that. So music therapists, we're lucky we have this tool that we can sing a song, we can talk about the person in the song or the topic in the song, and then we can talk about how they relate to the song. So there are so many different songs out there. You can pretty much find a song for just about anything people are going through. And maybe they might not identify with every single part of the song, but they'll identify with some parts of it. And so you use that to help break down the walls so that they can talk about someone else and then talk about themselves. That's kind of like a little overview of lyric analysis. So does everybody have one? Do you guys like to sing? You don't have to sing, but if you want to sing, I'd love to have you sing. It's good for your health and your self-care, by the way. Does anybody like to sing in the car or the shower? That's so good for your mental health. When you're making music and singing, you can't think of anything else. You can't. You absolutely can't. And you'll see today when we do some of this that you can't think about if you have anxiety, thinking about what you're worried about, things like that. You can't even think about it because you're in music. So that's helped me out a lot in my own life as well. All right. Here's a little song I wrote. You might want to sing it. No, don't worry. Be happy. Every life we have some trouble. When you worry, you'll make it up. Don't worry. Be happy. And don't worry, be happy now. Ooh. even think about anything when you were just singing and listen to that, could you? Isn't that cool? You can just get a mental break just by listening to music and singing. And that's something you don't have to have a music therapist to help you with. You can do that right at home. You know, you can match your mood, whatever music you have. You can change your mood with music, depending on what you listen to. If you're feeling a little bit down, you can play something a little more peppy, and that'll help you a lot. Helps me. I use that on myself. Awesome. So we're just going to talk about how we would do a lyric analysis for this. So just this sheet that you guys have, I would give out to a group or an individual. We do this in a group setting as well. And then I'll ask some questions, which I'm going to ask you guys. Hopefully you'll be nice enough to participate. So something that I like to ask is, for any song really, is what part of this song stands out to you most? Is there a line in this song that stands out to you? Anybody?
Don't worry.
Don't worry.
Be happy.
Be happy. Yeah, which I think is the most important part of the song,
Exactly.
in my personal opinion. Does anything else stand out to anybody? But when you worry, you make it double. Do you guys think that's true? It's true, right? You can worry yourself sick. You can worry and worry and worry, and some things you just can't control anyway, right? So yeah, there's a lot of truth, I think, to that one too. So what do you think the overall message or the mood of this song is? Happy, right? Does anybody else think that has a different tone to it?
Encouragement.
Like serenity, encouragement? Good, good. So one thing I always think about and I love this song, I think it's great, but do you think that it's practical to never worry and just be happy? It's not really, right? When you think about it, it's not really that practical. I mean, if you don't have a place to lay your head, that's a pretty serious worry, right? But you just make such light of it, like, don't worry, just be happy, right? So, to a degree, this song has some, suggestions in it that, maybe it's not so practical to just not worry about anything. I mean, you have no money, you can't pay your rent, you have nowhere to lay your head. I mean, those are some pretty serious things. So, in music therapy, you want to be practical and think, yes, it's a wonderful, great song, but, it's maybe not normal for someone to never worry about anything, right? We all have worries. So yeah, you might worry a little bit, but there's a happy medium, right, in between not worrying so much that it makes it double, but also, being practical as well. So what do you think the person in this song, what do you think that he or she does when they experience hard times?
Well, just like you said, I think they try to find that happy medium.
We try to find a happy medium.
They do recognize that there's a problem,
Mm-hmm.
but they also know that there's a solution as well.
Yeah.
So therefore, you don't give into the worry to the point of not ever returning.
Right. They are acknowledging that there's a problem, but there is a solution or a way to cope and to not worry all the time and to be happy. I totally agree with that. I think, another thing I might do is sing and make music. I could be biased in saying that, but I do think that music, helps every situation in some way. And, when you're worried about things, you can sing this song and it can remind you not to make your worries double. Okay, so then if you turn your sheet over onto the back, so that would be like the part we would talk about the person in the song. Now this would be more towards the person who you're working with, so your group members or the individual you're working with. So I would have them identify 4 things that they worry about. Now you guys don't have to write this down if you don't want to. If you have a pen and you want to do the whole exercise, totally feel free. But if you don't write it down, I want you to just think in your mind about 4 things that worry you in your life. I mean, we all have some type of worries, especially, if you're an adult. Kids are carefree, but those are a few things they worry about. Sometimes it's adult children, right? It could be any number of things that we worry about. So just think about 4 things. It'll be just a minute to think about 4 things that you worry about. Just another minute, see a couple people still writing. All right, so you don't have to by me share, everything that you worry about, but maybe let's share just a couple of things that we worry about.
My parents.
Parents, yes. I think we kind of worry about our parents at every age. As soon as you're an adult, you worry about your parents. If you're a parent, you worry about your kids. That's definitely what? Your health, yes. We worry about our health, especially in the times that we're living in right now. A lot of people worry about their health, and if not their health, their mental health, right? Which all kind of encompasses into the whole person. Absolutely. Anybody else want to share something? Politics? Yeah, how about those gas prices? Anybody worry about those? Worry about those gas prices. That's on my list, y'all. Especially if you drive places for a living, right? Like we do. We do a lot of in-home therapy and things like that. Yes.
I'm worried about my career and
your career and you'll be successful. I think that that's a very normal worry, especially when you're in school. It's kind of like, I like to think of it as taking one stair at a time instead of thinking about the whole staircase. That's kind of what college is like, and it's a lot of work and it's a lot of money. But I think that if you just take one step at a time, that next step that's in front of you, you're going to make it to the top of the staircase for sure. And when you go to a good school, you're going to have a good career. Yes.
Well, given everything that's happening right now, I actually worry about our society losing humanity. And I mean humanity for one being, and kindness and compassion. Because when we look at social media and the news, it's scary.
I know, very divisive these days. We're all in it together in this world, no matter what our background or views or politics or religions. We really are in this world all together. So I totally can see that. Yes.
Ashlee, we have a virtual one here from, if I may read it, climate change, family issues, and completing responsibilities in a timely fashion. I like that.
I mean, when you're a mom or a parent and you work and you take care of a home and you take care of kids, I can see that. It's a lot. And just like the staircase, I just take one stair at a time instead of thinking about the whole thing, taking one day at a time for me. Yes, for sure. Yes.
Safety.
What was that?
Safety.
Safety, yes.
Driving from Orlando every day on I-4 has become murderous.
Wow, I-4 is definitely a crazy place.
And in my neighborhood, shootings.
Wow. I know, that's one thing that we hope we don't have to worry about is just our basic safety, Yeah. Sorry you have to worry about that. Yes, ma'am.
I know a lot of people say it's okay to worry, but I worry about failure and being the best I can be.
worry about failure and being the best you can be. I mean, I think we all, to some degree, worry about messing up. But you know what? We are human. You haven't messed up yet. Yes, you have. We've all messed up. And, that's how we learn. We learn from our mistakes. Is when we fall, we get back up. We learn something new. And, I think it's okay to fail because it's a learning experience as long as you don't stay stuck there. Kind of like this song, don't worry, be happy. You don't want to stay stuck in your problems, but you want to get up and keep going. You can't just, wallow in your worries and your misery every day. You gotta get up and take one step at a time and just do the best that you can, for sure. Does anybody else have anything they want to share? Any worries? That's a lot of worries, you guys. There's a lot to worry about in the world, isn't there? There's a lot.
We're a neurotic society.
Yes. So let's move down to the next question. So now that you have thought about 4 things in particular that worry you, maybe they're your top 4 things, or maybe just the first 4 things that came to mind. Now I want you to think, what happens to you physically, when you worry? Asthma, stomach issues, yeah. What else? Sleep. Sleeping too much or sleeping not enough? Not enough.
Eating habits.
Sleep too much. Yeah. It can really go either way. I see it go either way. Yes, ma'am?
Eating habits.
Eating habits.
Oh my God,
Yeah. Tension in your body. Yeah. Definitely. Yes. Closed off with isolation. Yeah. What about, yes?
Related to what somebody said, tension, but I definitely find stress brings out all my weak spots in my body, like anything that hurts, lower back, neck. I mean, it just goes,
You feel the tension
on fire. I mean, it really hurts. Yeah.
Yeah. What about your blood pressure? Do you think your blood pressure goes up? What about anxiety?
Yes, I have a comment here from the virtual audience. Shallow breathing.
Shallow breathing. And
Excellent comment.
Is really what that's like when you feel like you're drowning and you can't get a good breath. That is anxiety. That's an anxiety attack. And when you are so stressed out and so worried, it leaks over into your physical health, really. So if you're physically affected, which you can't, change your worries necessarily right away, but you can think of ways to decrease your worrying. So our next question down are, what are ways to decrease your worrying? So you could think of reading a book, watching a movie, listening to music, maybe you do yoga, maybe you do meditation. So just write down 4 things. I'll give you just a second to do that. 4 ways that you can decrease your worrying, and hopefully I'll give you a few extra tools today to help with this as well with music.
Ashlee, I've got quite a few here coming in from virtual, so if it's okay, we'll take some.
Glad you guys are there participating with us. Thanks
Yeah,
so much.
I know this is a little weird hybrid version, but I love it. I was going to say thank you, those of you who are participating with us online. It's great.
Thanks for participating with us online. And being such active participants, you guys are awesome. For sure. I love that we can do things online now. I think that's a benefit that came out of COVID, is that we can just go right online, no problem, that we can have this in person and we can have it online. Or if it's something like for us, music therapy, someone's not feeling well, we can just hop online, and we're all set up for that now. So that's a good thing that this is accessible to people who may not even live here, so they can still come on and hang out with us, learn some new tools. So what are some ways you think you can decrease your worrying? Does anybody want to share a few they have?
I came up with 4.
Okay.
This is what I do. I do breathing exercises.
Breathing exercises, excellent. What's the second one?
Tapping, you know.
Tapping, oh, okay, yeah, tapping.
I do walking.
Walking, next was
Talking, you know, calling somebody. And
talking to someone,
the
yes.
combination of the walking and talking is fantastic.
Walking and talking, yes. I do that with my mom. Yeah, good. Is anybody else want to share? Yes.
I want to read a virtual comment here, which I think is great. Forest bathing. Oh my God. And I think it's great. And I'm hearing so many programs lately also on NPR about just trees and you know, basically trees around us as much as possible and just immersing ourselves in it. That's a great comment.
I have to know, I want to know more about that. Like, is that in the rain or is this like a tub in the middle of the I'm a music therapist, so I can get behind, you know, unconventional things.
And then we have another one here, which I do that too. Tai Chi and yoga. Absolutely.
Yoga. Yeah. And we're actually going to do, our next thing up is going to be a guided imagery and progressive muscle relaxation, which is kind of in that same realm, which I'll tell you some more information about how you can do that right from your home. You don't even have to go somewhere. Yes.
Meditating as well as praying.
Meditating and praying. Yeah. That's the same for me too. Yes.
Another two great ones here. One is, I love this one. Thank you, Dorothy, for saying this one. Jamming with people in your bubble. I love that.
People in your bubble.
I love it.
We're going to be jamming together in our bubble today.
And another one, of course, music, not just listening, but making it kind of goes right along with it. Yes, agreed.
Yes, that's awesome. And sometimes you can find like a drum circle around, you know, in your area. And it's kind of fun to participate in. See all the different people come out. Yes. Cleaning.
Oh, yeah. I clean.
I do a lot of cleaning. Mm-hmm. Put some music on and just clean.
Mm-hmm.
Yes.
One more, walking, but not just walking on the beach. There's something about these. We're so lucky here in Florida, these ocean waves.
Yes,
The best free therapy.
I totally agree with that. Good. Does anybody else want to share anything? Good. You guys are such an awesome audience participants in person and online. You guys are doing awesome. So the very last question, who can you give all your worries to? Now, this could be God. This could be a higher power, spiritual being, whatever your religion is. This could be the moon, right? You're talking about bathing the woods. This could be Mother Nature. This could be the moon. This could be the ocean. Like she said, we live so close to the ocean, you know, giving all your worries into something so vast like the ocean and just letting it drift away. You know, there's a lot to just giving somebody a call. You know, maybe that's your mom, your sister, maybe that's a counselor. You know, if you don't feel comfortable talking to you know, your parents or grandparents or someone in your family, there are always counselors out there. Yes.
Writing. I give it all the way in my notebook.
Give it away to the notebook. Yes. Writing is so healthy. Same for like songwriting, poetry, all that kind of stuff. Something about when you write it down. One of the things I like to do too is write it down and then crumple it up and throw it away. You know, or like the ocean, let it flow away. You know, giving your worries to something, someone, or nature. So who else would you guys give it to? Yeah. Speaking to your future self. Yeah, I like that. That's awesome. Anybody else? Who do you give your words to or what?
I've been afraid over the years giving my words to someone that took on the words I took. So I try not to give it to another person. I like to pray.
You like to pray.
Give it back. Or I would take it, write it out, and burn it.
And burn it, yeah. That's like crumbling up, the same idea of burning it. Yes, I like that. And if you are spiritual or religious, you know, if you don't have somebody to talk to, you can talk to God or to a higher power, you know, or spiritual being, whatever, you know, you might believe in. And for me, you know, God's there all the time, day or night, listening for me, for my beliefs. So that's a nice thing, because like you said, if you don't want to give it necessarily to your family and make them worry, that's a good place to give it. But there are also always counselors. I think that a lot of people have the stigma with going into a talk therapist, or even to a music therapist. We do talk therapy too, but with music. You know, there's this stigma that's like, oh, there's going to be something wrong with me if I go and talk to a talk therapist or a counselor. And that's absolutely not true. And a lot of the times, you know, with your insurance, there's included so many sessions per year. And usually, I don't know about this college, but I'm guessing it's probably like Florida State and others where they have a counselor here that you could talk to as well. Yeah, she's saying there is. So, you know, if you feel like you're having a hard time, just reach out. You know, reach out and talk to somebody. There's nothing wrong with talking through something in your life, and you don't have to have any diagnosis or anything to do that. So, know there's always someone or something that you can talk to and give your words to. I think that's very healthy to get it out on paper, in a song, in a prayer, and talk therapy to a friend, something like that. Yeah. Does anybody else want to say anything about, did you guys like this, or do you want to make any comment? Yes.
I was just going to say that another way to get counseling is for most employers have an employee assistance program where they actually provide free counseling.
Yes, big corporations probably will provide counseling and insurance. You'd be surprised that you get so many visits included in your insurance every year. And you don't have to have like a major problem to talk to a talk therapist, you know? It can just be, you know, you're feeling stressed about things. I'm changing this. It might change. It might change.
Is that, can we hear that? No, it's not on you. Sorry, we had to change mics for the virtual audience here. 1 second. Let's see.
Testing.
Oh, I think that's better.
Well, good thing we have virtual people to tell us if it's not working. Does that sound better, virtual folks? Give a thumbs up, a yes. You can hear me all right? I feel like I'm doing pretty well.
It should be, no.
Yeah,
That looks like it's working, I think.
it's working? Okay, good. So yeah, does anyone want to make a comment on lyric analysis? What you thought or felt or anything? Yes.
I was just kind of a comment, but I heard before, like, just studying, music, dissecting music, it doesn't always have to be about an actual relationship that you have with the person.
Yeah.
Sometimes it's that I love my dog so much, and instead of thinking, like, don't worry about people and the terrible, it's like, don't worry about, you know, your pet.
Yeah, absolutely. You can use songs to relate to really anything. And, you know, music's kind of like poetry. You can interpret it any way you want, you know, which is usually why I say what first stands out to you, because that's going to be different for everyone. And so as a music therapist, you know, we have in mind what thing you're trying to cope with, or maybe some of the challenges that you have. And so we're going to go and try to find some songs that we think might be relatable. Like I said before, you know, maybe not every single line in the song will relate to that person, but it will get them thinking about somebody else and then feel comfortable enough to maybe open up and talk about their own ways of coping or what they're going through as well. So this is a very valuable tool in music therapy for us, and it's awesome. So, you know, the way you can use this at home is listen to lyrics. You know, I feel like so many times we just are, you know, just listening to songs, not really listening to the lyrics. So take time to listen to the lyrics, and you'll listen to it a little closer and learn something new. All right, cool. So next up, we are going to do a guided imagery and a progressive muscle relaxation. I'm not sure why you give me 10, you told me.
We've,
See this, like, I don't know why.
yeah, it's 11:35, just so you know.
11:35. I have until 12, right?
No, until about 11:45, 11:50. It's okay.
How does the hour go by so fast? How is this with music, you know? All the fun stuff goes fast. Wow, so we only have 10 minutes. Okay.
Well,
how long-
15 is okay. Yeah.
So See, that's what I was worried about when I texted you last night. I was like, I always have too much to do, not enough time. That's like the story of my life, y'all. So I want to give you guys a choice, I guess, since I have two things left. I had this progressive muscle relaxation and guided imagery or drumming. I think that progressive muscle relaxation would be really good self-care, something that you can use at home, which we can talk about. But drumming you can also do at home or in a group as well. So I want to take a vote, okay? Because as you sit there, we want to gear it towards our individuals that we're working with, right? So we want to know what would be most valuable to you. So raise your hand if you would like to do guided imagery and progressive muscle relaxation. Okay. All right, that's 6. And who would like to do drumming? Progressive muscle relaxation.
It is.
Which is great because this is something that you really can use at home. You know, if you don't go to a yoga studio or something like that, this is definitely, you know, a tool that you can use. So I'm actually going to sit down for this one. I don't know if I'll have to adjust this. Well, I'm still in it.
Yeah, the camera is good. I think it's the mic that we need. Thank you, Deja. That's great. Perfect.
Bring it forward.
The mic. Deja, can you bring the mic forward a little bit so that it's in front or just in front of Ashlee? Thanks.
We're just going to have to schedule another time to do drumming.
You got it.
So many things I can bring to you guys. I do the best job ever, don't you think? Yes. And it's a good way to make a living in music because when you're a professional musician, it can be pretty hard unless you're really amazing. So I always love the idea of my career that I can be involved in music every single day and make a living and make a difference too with people. Okay, so to give you just a little information about what we're about to do. So the first part of this activity is going to be a guided imagery. So I want to invite you to make yourself really comfortable in your chair, where you maybe like lean back against your chair and feel really comfortable, so that you can close your eyes and work on relaxation. So you can put your hands palms up or down, whichever is most comfortable. And so the first part of this is going to be a guided imagery, and then the second part is going to be a progressive muscle relaxation. And I'll give you instructions such as curling your toes tightly for 5 seconds and then breathing out and relaxing. And we'll go through all the different parts of the body. So go ahead if you're comfortable, make yourself comfortable in your chair. Now as you sit, feel the connection between the back of your body and your chair as you are seated. Now lengthen up through your spine, broaden through your collarbone, and let your hands rest on your thighs. Once you're settled, close your eyes and notice your breathing without trying to change it. Now inhale through your nose. And then exhale through your mouth. Continue to take deep, full breaths in through your nose and out through your mouth. As you breathe, become aware of the state of your body and the quality of your mind. Where is your body holding tension? Do you feel closed off or shut down emotionally? Where is your mind? Is it wandering? Or is it at home within the breath? Is your mind at ease or filled with restlessness, negativity, and doubt? Now I want you to place both your hands over your heart. Continue to inhale through your nose and exhale through your mouth. Ask yourself, how does it feel to place my hands over this tender area, this place where I experience love for self and for others? Let your breath become more smooth and effortless. And begin to breathe in and out through your nose. Feel the flow of air moving into your lungs and then back into our world. With each exhale, imagine you are releasing any negative thoughts that may linger into your mind. You can put your hands back onto your legs again. I want you to continue to focus on your breathing. With each exhale, imagine you're releasing any negative thoughts that may be lingering in your mind. Breathe in and breathe out. Continue to focus on your breathing. On each inhale, I want you to think to yourself, say to yourself, I am worthy. I am enough. Let each inhale draw in self-love. And exhale, release what is no longer serving you. All those worries we talked about. Take a few minutes to breathe and recite this mantra internally. I am worthy. I am enough. Notice how you feel as you say these words to yourself. If your mind wanders at any point, no, that's okay. That's normal. It's the nature of the mind to wander. But just simply bring your attention back to your breath. Listen to your breathing and focus on it. Notice how your thoughts come and go, whether positive or negative. And simply allow them to pass on by like clouds floating in the sky. Now visualize yourself standing in front of a mirror. And I want you to look into your own eyes. What do you see? Is it pain and sadness, love and joy, neutrality? Regardless of what appears in the reflection, tell yourself, I love you. You are beautiful. You are worthy of happiness. Let's tell ourselves that one more time. I love you. You are beautiful. You are worthy of happiness. Now that what you see in the mirror in this moment may be different from what you see the next time you look. Imagine now that you can breathe from head to toe. Breathe here and know that love is always available for you when you need it. Now breathe in deeply through your nose. Continue breathing deeply during this next exercise. You're going to tighten each muscle group as tightly as you can for at least 5 seconds, and then relax them. Breathe in deeply and curl your toes tight, 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 and hold for 5 seconds. Then breathe out and relax. Now breathe in deeply and flex your feet, toes toward the ceiling so you can feel your shins tighten and hold for 5 seconds. Then breathe out and relax. Breathe in deeply and point your toes to tighten your calf muscles. Hold for 5 seconds. Then breathe out and relax. Breathe in deeply and flex the bottom of your thighs so your feet are lifted off the ground and hold for 5 seconds. Then breathe out and relax. Breathe in deeply and tighten your rear. Hold for 5 seconds. Then breathe out and relax. Breathe in deeply and tighten your abdomen or your stomach muscles. Tight, tight. Hold for 5 seconds. Then breathe out and relax. Breathe in deeply and make tight fists and squeeze and hold it for 5 seconds. Then breathe out and relax. Breathe in deeply. Spread your fingers out. Open up your hands and hold for 5 seconds. Breathe out and relax. Breathe in deeply and make loose fists and pull them towards your body to tighten your forearms. Hold for 5 seconds. And breathe out and relax. Breathe deeply. Pull your forearms in tight towards your body to tighten up your biceps. And hold for 5 seconds. to the world. So how did that make you guys feel? Relaxed? Good. Did anybody almost fall asleep on me? Yes.
Rejuvenated.
All the people at home, they can lay on a couch.
Yeah, I know.
Yes.
I didn't realize how tight I was.
How tight you are, right? You don't realize.
It was amazing.
It's like you just go about your day. You just don't even think about. You just do what you have to do. If your neck's tight or whatever, you just do what you have to do. You don't even think about it. I love how this brings more awareness to that very thing. Does anybody else want to make a comment about how they feel? Took the stress out. Good. I'm so glad. That's why I chose this activity for you guys. I wanted to do, and music therapists do a lot of different guided imagery. But I chose this one as a self-love. Yes.
There's a great comment virtually. It was honestly overwhelming how nice it was. Yes, I agree. So much kindness for self. That's a great comment. Thank you. Yeah. Yeah.
So, does anybody think that an exercise like this might be valuable to use in their everyday life? Yes. Yes. Now, I know you guys don't have me at home with you. I can't follow you home every night and play and relax you, right? But there are a lot of great resources out there, especially YouTube, actually, which is free to pull up, and you can look up, guided imagery or progressive muscle relaxation, which is the second part that we did. And I always get this question. People always ask me, "Oh, what's the most relaxing music?" Wow, that's a great question. And the answer to that is whatever music relaxes you, right? So as you're learning about yourself and doing this at home, like I recommend trying to do this, once or twice a week. But as you're getting to know yourself and what relaxes you best, you'll know, yeah, that was a good one, or no, it wasn't, and you can kind of put it into your toolbox and just keep track of what helps you. There is a big CD series. I think it's pretty big nowadays. It's been around a very long time. It's called Liquid Minds. It's kind of, how to describe it, it's kind of like a mix between the music you hear when you get a massage or like you go to a nice, spa or something, mixed with kind of new age sounding kind of music. But it's been around a long time, and they have a lot of tracks that are incredibly long. So, you can listen to this in earbuds or just out in your bed, and they're not scripted. So you can listen to unscripted music, meditation music, or it can be scripted. It could be either one. But Liquid Minds doesn't have any script on it. But it's such an incredible, it's almost like a journey, sort of like what you guys experienced, but just in music instead.
I found that, like say, negative female thoughts.
Yes.
When I got really hard at the end, it was kind of like
It's like for a few minutes, you don't have any worries. You can focus on yourself, right? Self-love, which was the part of our guided imagery, and self-care, which is really what this whole day is about. Like we talked about all the worries in the world, but there are ways that you can cope, right? There are ways that we can help decrease our worries and feel better doing it. Do we have a question online?
Well, actually, a great comment from actually a former student of ours who's now a teacher. It says, "I'm going to try these with my students to ease the nerves before performances and important rehearsals." I just wanted everybody to hear that, because I think that's a wonderful way, right, to reduce that kind of performance anxiety.
Real thing, okay? And no, it does get easier with time, as I'm sure most of you are musicians will know. You still always have some level of nervousness before you perform or talk to people or whatever, and that's totally normal and healthy. But this is absolutely a great way where you don't need any medication, you don't need any therapist with you there, that you can control and do yourself, which is pretty amazing. Music really is like medicine, by the way. So many times in the hospital, they wouldn't have to use pain medication or use more anxiety medication for people because they have music available, which is really incredible. Yes.
I like Shavasana yoga without having to listen to the whole yoga class first.
Yes, it's like yoga without all that hard work, right?
I love it.
Yoga's hard, isn't it? It looks slow, but it's harder than it looks. So yeah, and especially, for older people or people that might have some type of limitations in doing yoga, they can still get the benefits of the meditation part without having the physical demand part of it. So it really makes it adaptable to anyone. Yes.
And Ashlee, I wanted to ask a question since we have quite a few faculty sitting here. I mean, I know we're always stressed about our students performing, doing this and that. We never take the time to do this. And I guess my question is, I'm wondering, you made me think we should maybe reconsider some of our performance seminar recital situations where, I don't know if before, but certainly afterwards, especially, right? To just do this. I mean, that took 10 minutes? So maybe we do just 5 minutes, but just to really, I think for teachers, for professors to start thinking about that too. I think for our own and especially our students' self-care, right?
Absolutely. And as musicians, we're always playing music for other people. I just want to make this point. We are always playing music for somebody else, right? We're always playing to whatever we have to learn in college. I'm actually now a saxophone player. That's my primary instrument. So, even though I love jazz, I gotta play all the classical stuff. I'm always playing, to learn and to play for someone else. Even as a music therapist, we're playing preferred music and things like that. So I challenge you to take time to play music for yourself. That's harder than you think, isn't it? Like, does anybody here play music for themselves on a weekly basis? More than once a week? More than once a week. That's like 1-2 people maybe. And I am also guilty of this as well. This is something that I can work better on for my own self-care. Having 2 little children, running a business. We have a big business. We have like 200 students in our school in Volusia, Orange County. We have 8 teachers. So you can imagine, my plate's pretty full. There's so much, and someone asked me not that long ago, oh, what songs do you play for yourself? And it just hit me like I hit a wall, like, oh, I don't play anything for myself really. So whatever you play, and music therapists, we play guitar and piano and whatever primary instrument is, we sing. A lot of us play ukulele as well. Just any of them. It doesn't even, you don't even have to be like amazing on it. Just play some music that makes you happy. Something for your own self-care. That's something we miss, I think, as musicians a lot. Yes.
I want to make the comment that it also is important about which music you play, because even though we love R&B and we love hip hop and it makes us feel good, we're not realizing that music is also damaging and it's not something that's calming us down.
That's a great comment.
She was saying that, music definitely has a lot, it's very powerful. And sometimes even though you're not listening to the words, it's going into your subconsciousness. Mm-hmm. So, and everybody knows there's positive and negative music, there's good and, not so good music. And, it's okay to listen to fun music and things like that, but you should definitely be aware of how it's affecting you and the words, and that you want to be feeding your soul and your spirit and your mind and your body things that are going to encourage your life, that are going to influence you in a positive way. And be careful, because music is so incredibly powerful, which is why you need to be a music therapist to use it, because it really can be damaging, believe it or not. If you go into a hospital or a hospice setting where someone's really struggling a lot and you play loud music or, something that's not their preferred music, it really can, be harmful to people. So I don't think a lot of people think that, but, we spend a lot of time knowing how to manipulate music to help people in a good way. So that's a perfect comment. For sure.
That's a great comment. And okay, so lesson for next time, we need to make this a 90-minute session, I think. I think almost every session needs to be 90 minutes. No. But drum circle next year. You got a standing invitation, I think. I know. But we're going to take one more question here from Mr. Rame, and then we've got to cut it off, please.
I had a teacher in New York City. He was the soul. And after every voice lesson, she would vocalize it. She would read it. So I got up to coverage one day to ask her, why do you vocalize when I read my lesson? She said, I to get you out of sleep. So I could return back to myself.
It's funny. I always say as music therapists, we take a lot of stuff in, like a sponge. So it's similar, right? We take a lot of people's problems and things in, especially in a hospital, hospice, or mental health thing, juvenile retention, I have
Right.
experience in. You're like a sponge. You take that all in, and it takes some time. It takes some experience and practice to, at the end of the day, squeeze this sponge out, like you said, so you don't internalize all of this inside of you. Because as a therapist, you deal with a lot of people who are having a hard time. So yeah, just like your vocal coach. I don't know if that's a compliment or not, but right.
Well,
But
she did that ever.
squeezing us out, yeah, probably maybe my sax teacher might have felt like that sometimes
Yeah.
before. Yeah. But yeah, absolutely. So just practicing, like you said, getting the worries away, writing it down, burning it, throwing it away, giving it to the ocean, giving it to God, talking to someone. Yeah, absolutely. Well, thank you guys all so much for having me today.
Ashlee, thank you. That was fantastic. And just a brief comment, I guess, to everybody, but also the virtual audience, please. I hope you all come back at 1 o'clock promptly. 1 o'clock it actually starts, so I would say 5 of 1. We are going to continue all these fabulous themes from this morning with Nadine Huesner on mental health, wellness, and self-care. Like you said, we don't take enough time to play for ourselves. We don't take enough time to take care of ourselves. We always take care of everybody else. And then finally, we had so many comments of Tai Chi and yoga as a release distressor. We're going to have a fabulous interactive workshop on Tai Chi, and then a fabulous acupressure who's going to actually lead us through an acupressure routine that we can do on ourselves. So I hope you all come back, and please, the virtual audience, please use the afternoon YouTube links. And then everybody else, I will see you at 5 to 1. And thank you everybody for joining us. And Ashlee, thank you so much.